osseous drill. You drill the distal femur anteriorly. Some people are able to do umbilical vein catheterization, we're not. And then you give the medication that we give every single dead person first is epinephrine, adrenaline. Okay. Any questions on that? It seems like a lot, right? It is a lot. And it's there's such low frequency in these patients that people shit themselves. If it's not something you think about at least once a month, you're not going to be ready for it. And remember, you already know how to ventilate. You know how to position, stimulate that kid, piss the kid off enough to the kid wants to take a breath. Hopefully, and that's usually all it takes. If it doesn't, breathe for him a little bit. Everything's in a 30-second chunk. This is one of those things if you don't practice, you know, we just fucking drive. Open fire. So remember I said, you know, warm, dry, stimulate, position, and then suction as needed. When is it needed? There's chairs back there, Mark.
When they're not breathing?
If they're not breathing, then it's, you want to breathe for them.
Aspiration.
Yeah, so if there's an obstruction, I guess it's self-explanatory. If there's something to suction, you think it's impeding ventilation, suction it out. The best suction is the one we have on the wall. Usually don't have that readily available, so you have that in your OB kit, you have that bulb syringe, which is good for almost all kids. Almost. And you said 5 seconds? Max
35.
How long to suction the kid? I flipped it on you.
Oh,
I'm sorry. And then we have that, there's a little knob on there that says like PD, an adult. So you actually turn the volume down, the vacuum down on it. You'll see it on the suction. On the ones we have, there's a white plug. You can pull it out or push it in and it changes like adult and kid. Okay. There's something that we refer to, and this is not commonly talked about, which is to say never, delayed shock in a pregnant patient. So the pregnant patient has a traumatic incident, and they maintain for a much longer time than a non-pregnant. Why is that?
They have more blood.
Because the increased volume of the blood in the body.
That's right. That's all you need to know. And just if you're a factoider, 48% more blood volume. If that means anything to you. It's not on the test, but 48% more blood volume. That's why they can stave it off longer. This should be normal signs and symptoms of shock. Good. All right. So this is kind of all over the place. What position are you going to deliver this baby in? Are you going to assist the mom in delivering? First? Remember the name of that position? Mark, remember that there's a name for it, lithotomy?
I just did normal position.
Let's go. Come on, Mom. Yeah, so on the back, hips elevated. If she wants to be on all fours, then she kind of gets to be whatever she wants, unless you're driving. So we talked about knee chest, which is another position. Who would you put in a knee chest position? What type of delivery? Breech. Is breech, what does that mean, breech?
Buttocks or leg presentation.
Butt or leg? Okay, or legs. That's probably the worst one if it's one leg and the other leg's up next to the head. Yeah, that's gonna be rough. Okay, so knee chest or all fours, good. The problem is in the ambulance now, mom who's got a few extra pounds on, she's high centered. So if you got somebody like, Luke driving, that mom, as soon as he takes any kind of turn, she's coming off the gurney. Yeah. Mark had to suffer Luke as an intern.
Worst driver ever.
We both, you guys know Zofran is for?
Yeah.
What's it for?
Nausea.
That's right. Mark and I took Zofran at the beginning of the shift, every shift. driving so bad. What is
Downward dog.
Ash to the sky, like that, you know what I mean?
Knee chest.
Knee chest, yeah.
Is
Sorry.
that the only thing you're gonna do? What else do you do for knee chest with prolapse? So position the patient.
Try to like position the core, right? No, you don't touch it at
Position
all.
the fucking.
My bad, my bad.
You don't
Yeah.
Oh,
touch
shut
it.
up.
So you can insert a few fingers, you're gonna try to get the head off of the cord.
Mhm.
You guys, you haven't, maybe some of you have, but the cord should be purplish, blue, purple, and you feel the pulse on it. When it's, when the cord's compressed or there's no blood, it is chocolate, so opaque white, and there's no blood flowing through it, it's blood vessels, right? Arteries, veins, what do we got in the cord? How many?
arteries,
There's
one vein.
there's three vessels, what are the name of them?
One vein, 2 arteries.
One vein, 2 arteries, yeah, so vein and then 2 smaller arteries. Yeah, so you don't put pressure on the cord, if you get hands on the face or the head, you try to lift the head up off the cord. And you are that guy or that girl all the way into labor and delivery. I've done it twice. Crystal, I had her, she did it once when she was an intern. All bad outcomes, all dead babies. All second trimester, also like late second, third. Okay. All right. You've had this on as a test question before. So you have a female in the cavity-prone years, you know, the gestational years. What are those gestational years?
8, 12.
12
What's menarche?
The
First menstrual cycle?
Menstrual
11.
cycle. 11.
And the last one, what's it, what do you call that?
Menopause.
Menopause. 40.
40.
11 and 40,
Oh.
it's not in your book.
You know, it is 40. My mom's like 45.
Yeah, I think it'd be really cool to get, like, be 55 and get
Menopause
pregnant.
It's their age.
I'm sorry,
He said, what is 55? I said, age.
why is it a problem to have a baby to get pregnant at 50?
It's like complications.
Why is it a problem? Why? Because the eggs are 50 years old, or however, that egg you carry your whole life, you don't make any more, yeah. It's like a fine wine, you know, there's some, you know, utility in aging, but at a certain point, maybe it's not, the egg is not as healthy. That's why women can now, I haven't heard about this in maybe 10 years, but you can have your eggs taken, X amount of eggs taken and frozen.
Yeah.
You know, so you have eggs
They
that,
give you money
your
for it.
20-year-old eggs or 18-year-old eggs, you keep them for 10, 20, 30 years, fresh frozen, and then now you're older, you've got your career established, now you feel like it's the right time to have a family. You can do in vitro fertilization, you can carry your eggs, your 18-year-old eggs in your 50-year-old body. So it was a big thing in the Bay Area after the internet boom, because Yahoo.
She's sexually
pick
active.
a system and then work through it. So you want to go reproductive system? Okay, so are you sexually active? That's one thing.
When's your last period?
Last menstrual cycle,
That was it. Was it regular flow?
was it on time, normal?
Yeah.
As much as it is? Okay. Get some birth control. All right, keep going.
How's your sexual
Any STDs? So how would you ask that?
Any abnormal
Hey,
discharge?
hey, doll, you got gonorrhea? How do you ask that?
Have any untested?
There's any burning when they come?
Yeah.
So what if I say, yes, I have burning, does that mean I have an STD or a UTI?
You don't know yet.
You don't know.
Yeah.
Okay, you have any pain? When if you wanna go urinary tract, are you making urine? If so, how often?
Color
If
and
so,
smell.
Color. If so,
Is it
amount,
purple?
and if so, does it hurt? Dysuria, urination, hematuria. So, okay, so that's urinary tract. And then for the STDs, do you have any discharge? The way you ask is, do you have any, you just say it for the guys, just be real matter of fact about it. Do you have any vaginal discharge? If
For the
no,
guys?
guys asking the girl.
Oh, I was like.
You guys might have some code that you guys know from high school. We don't know, we haven't broken the code yet.
Yeah.
We don't know the girl on girl code.
What's your color?
So, do you have any vaginal discharge? If yes, what color? If yes, is it, you don't use this word, but the medical term is malodorous. What's it smell like?
Yeah.
So you guys have a code, I don't know the code, but you need to ask. What if it smelled like fishy? That's a problem.
Bacterial vaginosis.
That's on the list.
BV.
BV, bacterial vaginosis. Okay. What else are you gonna ask? So that's GI, no, GI is next. Food going in, food going out.
Any bleeding, vaginal bleeding.
You already asked that.
Oh.
We're talking about like poop and stuff.
Yeah. When was the last bowel movement? How's your appetite? Last bowel movement? Any blood? And they'll always say no, don't take that. You're just kind of making the connection. Just want to ask them, was it diarrhea? Was it normal color? Was it black stool? Any blood in the stool?
Wait, where was school?
Say again?
Where was school? Oh.
Yeah.
GI.
And any recent trauma? Yeah. And you can have GI stuff, it can be, ulcer stuff, it could be diverticulitis stuff, it could be appendix stuff. So you do an OPQRST, and you should be done. Very difficult abdominal pain. What's the worst thing that we're thinking about?
Ectopic.
Good, no, 100%. Again, like I was saying yesterday, I always think of the worst and then work my way back to indigestion. Okay. You walk up, this is just like the first 15, 20, 30 seconds of your assessment. You have your patient who's appears to be in active labor, she's having contraction. Introduce yourself to this patient. How do you do that? How do you make that connection? How do you get to business right away with this person? What do you want to know right away?
The gender.
Tell me what's going
I'm
on.
so sorry, Noah.
What do you want to know?
How far up like
So you want to know
Crowning.
where's the baby? Where literally is the baby? Is the baby crowning? Is the baby's head out? If almost everybody has some sort of cover over that. It's what we do. Almost all of them. You want to know where the baby's at. Maybe the baby's completely out. Maybe the head is out. Maybe there's crowning. So I don't even think you need to introduce yourself at this point. It's nice, but like if mom's actively pushing, she can give a shit on what your name is. I'm not gonna be able to diagram your next couple sentences later. She's pushing the baby. So just make sure that she knows that you're there for her, and then she's gonna give you access, so to speak. And they called you for a reason. So, you show up on scene and there's no pain going on. The lady's laying there with a big bump. What do you say? I mean, is it literally like you got a pregnant lady, she calls you because I'm having a baby. What do you want to know?
Yeah.
Where's the baby? And so if she's not actively, I guess the reason I bring this up, don't say, I need to check and see where the baby's at in between contractions. It's during contraction is when you see where that baby, if that baby's crowning, because you can have a contraction when the baby's pushing, and then contraction lets up and everything goes back to normal. So unless the baby's head is out, she should know that, she can see. every time they say, of course, yes, please. They want you to see, they want you to help them. Okay? What else do you want to know? Let me just tell you. You don't be 100% focused just on the baby, which I think is important, but you still have the mom too. The mom can have an eclamptic seizure. Get the mom's vital signs. Get a history of the mom. Get a history of that pregnancy, and while you're figuring out whether we can do a quick dash to the ambulance and drive, do we have time for that, or should we set up here because the delivery's going to be imminent? If she's crowning, probably going to set up for the baby. A mistake would be to walk your patient down a flight of stairs who's grabbing a 90 and a pair of 80. Yeah. This means that labor is going to progress quickly, and maybe there's not as much muscle tone down there as there once was. And I'm judging. All right, APGARs. I want to know, there's a question that you have to calculate an APGAR score. Let me just, you can figure out the math on your own. The way I do it, I know, what's the top number?
2.
Total.
Oh, okay.
10, and then the minimum?
6. 0.
Oh, 0.
0. Yeah, so 10 is beautiful, 0 is dead, and there's that in-between one. So you kind of know already what 10 is. You know, the kid's thriving, moving, breathing, heart rating over 100. Yeah, so don't get too caught up on that. Don't get caught up in 0. Get caught up in the middle, what that looks like. See this kid, looks a little sketchy, and give it a 1. That's how I do it in real life. Because, to be honest, we usually got more stuff going on than just calculating that APGAR. But I'll leave it to you guys. I know you've done it before, I've seen you on the board, so just have another look at that, especially the ones.
Posters behind us.
Okay, stuff. Postpartum hemorrhage, you need to have a think about that. What it looks like. What do you do for it? We already talked about it. Postpartum, what's postpartum mean? After the baby's born, and the mom starts bleeding.
Massaging the fungus, skin to skin, oxytocin.
So baby to breast, massage the fundus. Okay. Maybe oxygen for the mom. Keep mom warm. You kind of treat for shock if that's where it's going. And pulmonary embolism. When does that usually happen? And it's kind of rare, but it's not that rare that we don't talk about it. 2 weeks. It can happen during the delivery, or usually within about 30 minutes after, just statistically. So you think that everything's fine, like we get a bouncing baby and everybody's cooing and babbling, we're all good, we're sweaty because it's stressful, we got the heat up, and then the mom, suddenly what?
Shortness of breath.
Sudden shortness of breath,
Yeah.
maybe chest pain, maybe dumps the pressure, maybe goes into sudden cardiac arrest. Yeah, it's catastrophic, these PEs for the mom, especially if it's amniotic fluid. Okay, and so how would you deal with a mom at that point? Same as you would on a regular cardiac arrest. There's nothing that you would do different. And then we talked about a little bit the consequences of PID. You mentioned it before. AI. It's not very common in the second. Preeclampsia, prolapse cord, 3rd trimester, eruption. What's the difference between the two?
Pain or no pain? Yeah.
Which one is which?
Pain is the
Previous.
Painless, 3rd trimester hemorrhage,
Previous.
placenta previa, painful. The data, because we have so much more data now, the data suggests that you really don't know. Because they've had previous with pain and abruption abruption is usually on palpation, just so you know, it's more like a tenderness that you're gonna get. Okay, they're treated the same. All right, we are, let's see, we did the inverse pyramid already. All right, tools, what's the answer?
Chill. Come on, Edward.
Adios.
Edward, you
Just give me a computer, I gotta write it down. Okay. 88. 88 what? 76. 88 chucks. 88 kilos? 88.3. Okay.
You chill. Not specific. Like YouTube? That was 90. That's 90 kg. Yeah, it's not bad. 90 kg, bro.